Hi, I'm Amanda Phelps, and I am going to go over the basic steps for CPR and also do a demonstration of chest compressions and breaths. So CPR is used when you have a patient that comes in cardiac arrest. It stands for cardiac pulmonary resuscitation. The first thing you'll want to do is, of course, assess your patient. Make sure their airway is open and that the compression and breaths will actually be effective for the patient. You'll start with 2 straight minutes of chest compressions. If you have more than one person that is able to assist you, that second person can do the breaths. If you are doing the compressions by yourself, you will do 30 chest compressions and then 2 breaths and repeat for 2 minutes. If you are able to intubate your patient, that is the best thing that you can do. It is not always possible. For our demonstration, I have a mask on our patient since I can't intubate a stuffed animal. He's going to have a mask on so I can demonstrate doing the breaths using our oxygen machine. If you don't have access to an oxygen machine, you can always do the breaths by cupping your hands around the mouth and doing breaths directly into the patient's snout. If you are able to intubate, you will need a laryngoscope, your tubes, ties to secure to the patient, and then also a cuff to inflate your tube so that the air is going directly into the lungs and not into the stomach as well. When doing your compressions, you want to make sure that you are over the top of the patient. Your shoulders need to be directly over where you'll be doing the compressions. For this particular demonstration, since we have a small breed dog or cat size, the compressions will be directly over the heart. To find that, you'll pull the elbow back, and then where the elbow meets the chest is where you'll do your compressions. If this was a large breed dog or a barrel-chested dog like a lab, German Shepherd, you would have them in lateral recumbency, but you would do your compressions over the largest portion of their chest. If this was a narrow-chested dog like your greyhounds, you would also do the compressions over the heart directly. If you have a flat-chested dog, such as a bulldog breed, you would flip them onto their back, so they're in dorsal recumbency, and then do your compressions directly over the chest. For this particular demonstration, we have a small breed dog or cat size, so we'll be doing the compressions directly over the heart. You'll cup one hand over the top, placing the heel of your palm over the heart, locking your elbows and extending your arms fully. You will then do your 30 chest compressions and 2 breaths. You'll close your valve, give 2 breaths, making sure not to go over 20. Then opening up your valve to allow free oxygen to flow and continue with 30 more compressions. Ideally, you want to do this at a rate of 100 to 120 per minute. And then you'll close your valve and give 2 more breaths. And then you will continue this for 2 minutes or until you have restored cardiac function. You may need to use some emergency resuscitation drugs such as epinephrine. Our emergency kit has your dosages for different drugs, including antiarrhythmics, your arrest drugs. and then reversal agents if needed. We have our weight in kilograms and in pounds, and it goes all the way from 5 pounds up to 100, so we cover almost every weight of pet that we see. If you have more than one person and they're able to calculate this dosage for you, they can administer it at any point during CPR. If you are doing this solo, you can administer this once you have done 2 minutes of your compressions and breaths, and then add in the resuscitation drugs to see if that can help restart the heart.